Hi, everyone. Thank you for joining us today for our webinar for DSOs and dental practices, surviving and thriving in the COVID-19 era. My name is Kayla Marty, and I'll be the moderator for the panel today. And thank everyone so much for our other panelists joining us. We're going to be having Bart Walker, who's a partner in our healthcare group here at McGuireWoods, Joel Spitz, who's a partner in our employment practice here at McGuireWoods, and Karan Garg, who's the managing director at Houlihan Lokey. So throughout the webinar today, we'll talk about a number of different issues that are facing DSOs and dental practices in light of COVID, which includes different programs that the government has recently put out, various challenges that you may be facing from an employment perspective, and then also challenges that you may be facing in the market. So to start us off, Bart is just going to kick through a couple of the initial programs that we've seen passed from the government.
Thanks, Kayla. Bart Walker with McGuireWoods. Thank you for the introduction. Thanks to Joel and KG for joining us today. Should be a lively conversation. What I'd like to do, as Kayla mentioned, we've got three different segments. One will be kind of on the federal relief programs that we're spending a lot of our time helping clients with. Number two, Joel, who's the former chair of our labor and employment group here at the firm, will go through some current events and hot topics for employers, and then finally KG will kind of wrap it up with an M&A market discussion as it relates to DSOs in the dental world. Just a few kind of contextual comments. I think this is a really challenging time for dental providers. I think as everybody would admit, most of them have closed offices. Either a significant number of offices is closed or all of them closed. A lot of them have already furloughed employees or laid people off. A lot of them are looking at rent deferrals or abatements. They're looking at modifying or obtaining new credit facilities. They're looking at the federal assistance program. So there's an awful lot of tumult out there, and there's also an awful lot of noise in terms of just the breakneck speed at which the news cycle moves today and how much is being published on a daily basis about recent developments. We spend a lot of our time counseling clients on these recent developments, but we thought the webinar format like this would help just cut through some of the noise and really focus on the most important aspects of these. To that end, we'd also love to answer specific questions that you may have. So feel free to submit questions through the webinar portal. There's a link that you can click on there that will bring up a question and answer box. And we will read those. We may not get to all of them, and some of them may be just too specific for this audience. We do have a really large crowd here of several hundred people, so some of them we may not be able to answer live, but I will promise we will loop back with every single person who asks a question after the fact if we don't get to it during the webinar today. So with that as context, let's just jump right into it. The first slide is just a very brief overview of some of the key stimulus programs for dental practices and DSOs. These are the main ones we're spending most of our time helping clients with, and that our clients are really diving into. The most popular one that's been in the news the most is the SBA Paycheck Protection Program. We'll go into the weeds of that shortly here. I think as many people have heard, that program is actually almost out of money or is out of money for the time being. Remains to be seen whether Congress will reauthorize it or not. I think it was a very popular program, so I'd be surprised if it doesn't receive additional funding. At least that's what we're hearing from our folks in D.C. We'll dive into the weeds of that and what the eligibility looks like. Number two, the Main Street Business Lending Program, which came out quickly on the heels of the SBA program. Number three, the CARES Act Public Health and Social Services Emergency Fund. This may be less applicable to dental providers. These are largely for Medicare participants, and those are grants that were placed in the accounts of Medicare participating providers in proportion to the amount of billings they had under fee-for-service programs in 2019. Those are really just grants. It's not even a loan program. So that's number three on the list. And then I thought I would just mention a couple of other items that really may not be applicable, but just sort of on your radar, because we do get a lot of questions about whether people are eligible for them or not. One is the Families First Coronavirus Response Act. Joel will touch on this a little bit later because it relates to severance obligations for and extended paid time off obligations for employers under a certain size. So depending on the size of your DSO or the size of your practice, this may or may not apply. And there are definitely strings attached to that. And although you may be eligible for a tax credit, there are some requirements that you have to satisfy to participate in that program. And then finally, there's also this Medicare Advanced Payment Program, which was broadly expanded, which allows the Medicare program to make advanced payments to providers. And the amounts can be pretty significant, but they aren't grants, they're not loans, they're advances, so they will need to be paid back or offset against future Medicare payments. Again, dental and DSO businesses tend not to be heavily Medicare. Some of them are heavily Medicaid, but not really so much the Medicare program. So again, probably less relevant to the audience today, but wanted you to be aware of that because that's something we get an awful lot of questions on. Okay. The next one is the SBA Paycheck Protection Program. Let's just pause for a minute here on this one. I'd say we have been spending a disproportionate amount of our time on this and just helping clients and helping lenders, quite frankly, navigate the rules of this program. Here at the firm, we represent DSOs, we represent dentists, we represent private equity funds, and we also represent lenders to this sector. So depending on where you're sitting in that whole segment, you need to understand the rules and how they apply. The risks aren't allocated evenly in the sense that the borrower really has the lion's share of responsibility for complying with these rules. But as an SBA lender, there are certainly rules that the lenders have to obey as well. So I think a lot of you have heard this. It's the PPP program or the Paycheck Protection Program under the SBA Loans. The SBA administers it under what's called the 7A Loan Program. They originally set aside $349 billion. And to give you an idea of just the magnitude and what we were dealing with and how quickly this money went, the program was announced, I think, on a Friday. And then they had some interim rules that were published the following week. There were clarifications and sort of FAQs published by SBA over the following 5 days. And then lenders opened up the program to applications. Well, you couldn't even get in an application because the systems were so clogged at first. And so everybody was trying to apply for these loans. And they finally got through, and now here we are, a week later, and all the funds are depleted. So it was wildly popular. It was very fast, and hopefully it gets refunded. The eligibility requirements, you have to have 500 or fewer employees. And we say here including affiliates. The devil's in the details. That's a really loaded term. The affiliation rules under the SBA loans are pretty complicated. And this is the one area where we spend a ton of time helping clients work through the affiliation rules. And depending on your structure, and if you have a private equity investor or other outside investors or ownership, any of your owners have interests in other companies, you may be required to aggregate all of those entities together for purposes of this 500 employee test. And if you have over 500 employees, you're not eligible. There are also a few exceptions to this. If you have SBIC funding already, you're automatically eligible, which is a huge win, kind of like winning the SBA lottery. But that's another thing to keep in mind I don't think we put on this slide. So these funds can be used to cover certain eligible payroll costs and overhead costs, and then these loans are actually forgiven, or they're forgivable. So if you are able to maintain payroll for a particular period of time, then the loan is actually forgiven, which is a really nice feature and part of the reason why it's so popular, I think. The recipient is not eligible for a refundable employee retention credit, and recipients can receive PPP loans and Main Street loans. So it's important to keep in mind that as we're talking through these various programs, you may be eligible for some of them, you may not be eligible for all of them. Some of them have restrictions on duplicate payments and what you can and can't participate in. Okay, next let me turn the next one over to Kayla. talk about the Main Street Business Lending Program.
Sure. So the Main Street Business Lending Program has been particularly attractive to individuals that may not otherwise be eligible under the payment protection program that Bart just discussed. They are true loans administered by the Department of Treasury and the Fed, and they've allocated up to $600 billion. There are some nice features to these loans, though. They have a reasonably low interest rate. They do have a floating interest rate equal to the SOFR plus approximately 250 to 400 basis points, and they may be prepaid without penalty. So those are some nice features to these. We've been receiving a significant number of questions about how do I qualify for these loans, what considerations may be present if I'm thinking about these loans. So I'm going to go through just a couple of topics that you may consider. So first and foremost, you need to be aware of any current debt that you have outstanding and work with your current lenders if you're interested in these programs. Often, if you do have current debt or affiliates of yours have current debt, you don't want to be tripping over any type of covenants or anything like that in your current credit documents. So first and foremost, make sure you're always consulting any current lenders that you have. If you don't have existing debt, one of the best options for you are going to be what are the new loan programs under the Main Street Business Lending Program. They usually can be the lesser of $25 million or an amount that would not trip the leverage ratios on the loans. And for all new loans, the leverage ratios are 4 times EBITDA. When you're taking out the new loans, they will be unsecured. So that is often an attractive feature to individuals looking to investigate these. It is possible as well that if you do have current loans with an eligible lender, you can actually upsize those loans under a new program, under the Main Street Business Lending. And those can have the lesser of a value of $150 million or 30% of the outstanding debt plus essentially the committed debt availability. Although everybody should remember, if you are upsizing your loans, you still aren't going to be able to exceed the applicable leverage ratio of 6 times for these upsized loans. So it can be really important if you're interested in these Main Street Business Lending Program loans that you look very closely at the terms that are released. Particularly, we've been receiving questions from our clients that are perhaps in the private equity space, and sometimes those entities have some trouble with these various leverage ratios. So you just need to look really closely at those to make sure that you are moving forward in a smart way. A couple of other just high points here before we move on these loans is they can't be used to refinance existing debt. We get that question very frequently. So just wanted to let everybody know that's probably the #1 question that we receive. And you can't have more than 10,000 employees in order to be eligible for these loans. So it's not that 500 employee threshold under the PPP program, but you do need to stay under 10,000 employees and be based in the U.S. with a majority of your employees in the U.S. So if you have other questions about those, we're always happy to talk separately about them, but that's just at a high level, that program that you all are all likely hearing a lot about on the news. And we do expect additional guidance on this program to be provided because the comment period for it closed, I believe, yesterday. So the next is the program that Bart mentioned that likely will not be terribly applicable to many of you right now. This is the $30 billion that were dispersed by HHS last Friday, or started to be dispersed last Friday, where individuals that billed Medicare on a fee-for-service basis in 2019 received funding based on their percentage of Medicare that they received last year. What may, however, in the future become attractive or interesting to the people on the phone is the remaining $70 billion. We do not yet have clear guidance on how the remaining $70 billion is going to be used or dispersed, But in a number of statements, the HHS Secretary and the CMS Administrator have both said that they may be dispersing funds to providers that are primarily Medicaid providers in hotspots for the coronavirus or for uninsured individuals. So there are likely a number of people on the phone that would be interested in the event that there was disbursements based on your Medicaid revenues. So just be on the lookout for that. We don't yet have any more information on that piece yet. So if you did, though, receive part of this $30 billion in funding last week or in the early parts of this week, you should be aware of the various terms and conditions associated with retaining these funds. Those are available on HHS's website, and they do have a number of strings. So, for example, you do need to be, if you receive more than $150,000, keeping records to be able to report and submit calendar attestations to the government each quarter. That's an important piece. And then also there is an attestation that is available and asked to be signed by the individuals who receive these funds that detail those terms and conditions that are now available on HHS's website. So with that, we'll go ahead and move on to the next portion of our program that Joel's going to lead about employee furloughs.
Thank you, Kayla. This is Joel Spitz, and as you can imagine, since the Families First Act came out, and I'm sure many of you are familiar with that, we've been dealing with nonstop questions about what do we do with our workforce, how do we handle a situation where we've had a downturn in business, and how do we also keep our best employees and at the same time save some money. So we've been dealing with a lot of issues, and since the Families First Act came out, which I'm going to talk about in a minute, there have been 5 different sets of Department of Labor regulations that need interpretation and discussion with clients and how to handle all the nuances of some federal legislation that was a little hard to understand at first. So we now have the benefit after several weeks of understanding what the Department of Labor has in mind, and happy to walk through that. Let me just start with employee furloughs, because we are getting a ton of questions about how you furlough employees and how do you do it the right way. So let me just mention some of the legal considerations relating to employee furloughs, and let me start with the different type of employee furloughs that there are. You've got an employee furlough with specific duration. You've got an employee furlough with an indefinite duration, which I would not recommend, and I'll tell you why in a minute. And then you've also got changes in work schedules where you can take 1 or more days off a week or rotate, take every other month, every other week or month off. So what we're typically recommending in a furlough is that you let employees know, if you're intending on furloughing them, that there's a specific date that you have in mind where they would be coming back. And the reason for that is most insurance companies right now, health insurance companies, are indicating that although you typically have to work a certain number of hours a week to get benefits, health insurance benefits, usually 30 hours or 32 hours, that they are suspending that for a couple of months so you can take your furloughed employees and have them continue to get health insurance benefits. So what we typically would say is put a date in that maybe is 6 weeks out, 8 weeks out. Let them know that you will reevaluate that at some point, probably 2 weeks before the end date, to let them know if that'll be extended. But that way they can continue to get their health insurance benefits. The other thing on a furlough, and there's a reason to do it, is that under a furlough, you can still get unemployment benefits. That was a big question we got early on is, well, if you're furlough folks, are they going to be able to get unemployment benefits? And the answer is yes. And so long as they qualify for unemployment benefits, and whatever those benefits are under state law, they will get the $600 CARES kicker on top of it. So frankly, for some employees, they may end up making as much or more than if they had worked. And so furloughs can be a really good option because they continue to be employed, they still have health insurance benefits, and they can get unemployment benefits. But frankly, a specific duration is probably the best bet to go on a furlough. Can we go to the next slide, please? Okay, so how do you treat folks that are on furlough if they're exempt or non-exempt? Let's first talk about the hourly non-exempt folks. It's pretty easy because if you want to do a furlough that isn't a specific duration or weeks or months, but you want to actually just have them work fewer hours. You can certainly do that for non-exempt folks. You have flexibility to set those hours and pay rates based on your business needs. And in some cases, you just need to make sure you give the appropriate notice to folks that you're changing their hours or their pay. Each state is going to be a little bit different on that. Can we go to the next slide, please? Let's talk a little bit about, actually, we can go back one slide. Yeah, let's talk a little bit about salaried exempt employees. So for a furlough with those folks, typically any work that you perform within a work week, you're going to get paid for that week. So you need to be a little careful here because you generally can't deduct weekly salary for absences. You can require employees to use accrued PTO for partial week absences to meet the salary requirement. The whole idea behind a salaried exempt employee is that you have to receive a minimum of $684 a week to meet the salary basis test. So it's important to do that. Let's go to the next slide. Okay, let's talk a little bit about salaried exempt and what some of the options are. Okay, so one option is that you could furlough employees on a weekly basis. You could furlough them for a period of time. The key there and why we indicate that it's option one is that the typical rule is, as I mentioned, you can't have somebody work for a day or two during the week, then furlough them, because if they do any work, even if it's for an hour, 2 hours, look at an email, whatever the case may be, typically they would need to be paid for the week. That's what the pandemic guidance has indicated. Okay, I will tell you there's an option too, and a lot of our clients are doing that, and that is take somebody from 5 days a week down to, let's say, 3 days a week, and make sure that the other 2 days they're not working. Now, this is not covered by the pandemic guidance. It doesn't talk about that. It's a little bit of a riskier option because it's based on old case law, indicating that you can reduce somebody from 5 days down to, let's say, 3 days. You can still pay them for the 3 days, and as long as they're not working the other 2, you're okay. But this is a little bit riskier. We don't know how this is going to come out. I think at the end of the day, when people look back on this, if you go that route, most judges are going to look at it and say, hey, you were better off having people work for 3 days than none. So we're going to allow that and say that so long as they didn't work the days that they were off the schedule, that you're fine. And we're now going to have to worry about a destruction of the exempt status. So we think that's probably fine. Now, another option, and this is option 3, is that we have a lot of our clients that are just reducing salaries. And you just need to give the appropriate notification for reducing salaries, but that's okay to do. You need to be a little bit careful about if somebody has a particular contract. But that's another way to consider, rather than having to worry about how much work an exempt employee is doing in a particular week. For example, if you took them down from 5 days to 3 days, you didn't pay them for 2 days, where you don't have to worry about whether they're answering emails or making phone calls or stopping by the office on 2 of those days. You don't really have to worry about that when you reduce someone's salary. So that's certainly another option with respect to an employee furlough, is reducing someone's salary. Let's go to the next slide, please. Okay, I mentioned employment agreements. This is really important, especially if you have employment agreements with dentists, you have employment agreements with any type of physician. We deal with this all the time, where typically an employment agreement would say you're terminated for cause, we don't pay you anything. If you're otherwise, we can give you 90 days notice, okay? And so what happens with employment agreements is if you're going to reduce someone's salary, you really want to make sure you're checking if they have an employment agreement that would provide for a particular salary. You work out an arrangement with them where you would amend the contract to indicate that they're going to have a reduced salary, and put that in writing to make sure it's amended. Why is that important? Because otherwise they may claim breach of contract. And what incentive do you, what leverage do you have with respect to those dentists, with respect to someone that has an employment agreement? Is you say to them, look, we don't want to go down this path where we give you 90 days notice and terminate your contract. This way, we're going to reduce your salary, but if you agree now and we get it in writing, we can work it out so that we can reduce your salary and have an amendment to the contract. So that notice provision is really the leverage that you have under an employment agreement with somebody. Okay, let's go to the next one, please. Okay. Mentioned earlier the Families First Act. Just something to keep in mind, and I'm going to talk about this in more detail when we run through the Act. But the question is, do you have fewer than 500 employees? If you have fewer than 500 employees, the Families First Act is going to apply to you unless you have fewer than 50. And if you have fewer than 50, there's an argument to be made if you would have to comply with the Act and then you would have difficulty in the viability of your business that you would not have to comply. I'll give you more details about that in a few minutes. But something to keep in mind on the Families First Act is if you have fewer than 500. There are also ways as potential measures to reduce hours, as I mentioned. There are a lot of our clients that are allowing employees to accumulate a negative PTO balance. We can talk about that if anybody has questions about that. That's somewhat difficult at times because recouping that later may be difficult if someone leaves. And then also placing on a furlough. And I get a lot of questions from companies, practices who are calling and saying, well, if we furlough employees, aren't they just going to take another job and leave us? And there are ways to incentivize folks to come back if you provide them a return to work bonus, which certainly is an option. So if you have questions about that, happy to discuss that as well. Let's go to the next slide, please. All right. I'm just mentioning very, very quickly here the Federal Warrant Act, which requires you to provide 60 days notice if you either have a mass layoff, that's where you have 500 employees have an employment loss, or you have 50 more employees that make up 33% of your workforce. You have to give 60 days advance notice. Next slide, please. What is an employment loss? That is a termination of employment or a layoff exceeding 6 months. Okay, there are some exceptions to this, and specifically California more recently indicated that most likely they're going to suspend the Warrant Act. And a lot of states have mini Warrant Acts. There's the Federal Warrant Act, and so when I say mini Warrant Acts, I mean instead of 50 employees, it may be down to 25 employees who are involved in a mass layoff. You have to give the 60 days notice. But the question becomes, do you really have to give the notice in this circumstance with COVID-19 where there are unforeseeable business circumstances, or it may be considered a natural disaster? And I think that ultimately that is probably going to be a test that most judges will look back on and say you did not have to give the notice, or you just had to give it as soon as you practically could under the circumstances. So my point is, I don't think the Warrant Act is going to come into play all that often here, unless you're talking about some type of a plant closing or something along those lines. So I think we're in pretty good shape on the Warrant Act, but obviously happy to answer any questions about that. Can we go to the next slide, please? Okay, let's talk a little bit about the Families First Act. So there's two parts to it. One is the emergency paid sick leave, and the other one is the emergency paid family and medical leave. Next slide. Okay, what is the emergency paid sick leave? First of all, it only applies if you have fewer than 500 employees. If you have less than 50, fewer than 50, that's something we can discuss because you have to meet a test, which is going to be somewhat difficult. Who's covered under the Emergency Paid Sick Leave Act? That's all current part-time and full-time employees. Okay, and employee coverage exception is employers of healthcare providers and emergency responders. And that definition of healthcare providers is a very, very broad definition. And so, there may be an exception there with respect to certain practices. Go to the next slide, please. Okay. What do you get under the Emergency Paid Sick Leave Act if you're an employee and you're covered? You're going to get 2 weeks of paid leave. That 2 weeks of paid leave is up to 80 hours. If you're a part-time employee, you're required to provide a total number of hours of paid sick leave equal to the number of hours the part-time employee works on average over a 2-week period. So this is really just the first 80 hours of paid sick leave. Next slide, please. All right. What does this cover? Okay, this covers if you are quarantined, if you're self-quarantined, you have a diagnosis to obtain a medical diagnosis if the employee is experiencing symptoms. And what do you get under the Act? What you get under the Act is the first 80 hours, full pay at the regular rate, up to a cap of 511 per day, in the aggregate of 5,110. Next slide, please. In addition to that, you can get the following with lower pay, which would be you're caring for a quarantined individual, child care if your child's school is closed, or substantially similar care. And under those circumstances, you would get 2/3 pay at a rate up to $200 per day and $2,000 in the aggregate. So this emergency paid sick leave that I'm talking about here, where you're either going to get your full pay up to $511 a day, or you're going to get 2/3 of your pay up to $200 a day. These are just for the first 80 hours. And under those circumstances, you're going to get, as an employer, a tax credit with respect to that. Okay, let's go to the next slide. So with regard to leave sequencing, you may use your paid sick leave first before you're required to use other leave. Okay. An employer cannot require an employee to use other leave, but I will tell you that we just got guidance out today, as a matter of fact, that said that you need to at least allow employees to use it to supplement their pay if they're not getting their full pay. Okay, and this was all effective as of April 1st, 2020. All right, so this just came into effect April 1st. So with respect to folks that took leave prior to that time, they would not have been eligible under this Act. So that all applies to the first 80 hours. So let's go to the next slide, please. Okay. We've talked about the emergency paid sick leave. I want to move over to emergency paid family and medical leave. So the first 80 hours was the sick leave. There are the 6 ways in which you could get paid. When you're talking about the remaining 10 weeks of a leave, the only thing you're going to be able to get is 2/3 of your pay, up to $200 a day, if your kid is off of school. So I talked about that in the first 80 hours. That is going to be the case with respect to the emergency paid family and medical leave. Okay, and so for the remaining time period, the 10 weeks, you're only going to get 2/3 pay, up to $200 a day. Now, obviously, you get a tax credit as an employer with respect to that, and it puts you in a position where you can make that payment. Now, I will tell you, because I get this question a lot, what if somebody has used up their FMLA time or a portion of it prior to the time that they need to take this leave? Well, the only amount you get in a rolling 12-month period is going to be a total of 12 weeks. So if you have folks that have used up half of their FMLA time prior to the time that they want to take advantage of this Act and get paid under the Act, they're not going to be able to use it for the remaining 12 weeks, only the remaining part that they have for a total of 12 weeks under the FMLA in a rolling 12-month period. Happy to answer any other questions about that if you'd like to do that at the end. So those are the highlights with respect to the Act. I'm happy to answer any questions that anyone has during the Q&A, but I'll turn it back over at this point.
Great, thank you, Joel. And I think now Karan is just going to go through some highlights of things to consider with respect to the market. Karan, if you could just speak a little bit to what you're seeing and how you anticipate COVID-19 to impact transactions in the future. I know we've gotten a lot of questions on valuations particularly, and then the strength of the market following this pandemic.
Yeah, thanks, Kayla. Happy to do it. Thanks, everybody, for joining. So, this has obviously been a challenging time, and even more so for the dental space and dental sector. I think in most cases, it has been impacted disproportionately to other sort of healthcare subsectors, if you will, both from severity of impact as well as what the rebound duration may be for the sector, and I'll talk a little bit more about that. As of, I saw a few questions around M&A activity in the space, as of today, and from my understanding, most of it is paused for the time being. And part of it is because nobody really knows what the bottom is. The volumes are, at least for dental, down anywhere from 70 to 80%. Most offices are either open only for emergent needs. Now that differs a little bit, varies a little bit based on geography. It also varies a little bit based on specialty. We have seen sort of oral surgery and endodontic practices more active than not because of sort of essential needs for those kind of services and practice, those kind of procedures. But for the most part, M&A activity has been at a pause, and as I said, it really sort of depends around what the bottom is, and more importantly, what the recovery looks like. And the trajectory for the recovery, in my mind, is a multivariable equation, which is dependent upon a few different things, including sort of, as I mentioned, geography. Some, South is less impacted than the Northeast and the West. So, there will be sort of phased rebound or recovery in volumes across those geographies. Second is around sort of service mix. I think more essential services will come online faster. And in some instances, you can almost consider those essential services being, almost like a backlog inventory as opposed to deferred or lost inventory. I think the patient mix also matters, specifically for practices or DSOs that are focused more on new patient versus existing patient. I think the new patient dynamic will be trickier given everybody is, from a defensive mechanism perspective, conserving cash and not spending dollars on marketing or engaging with new patients. So turning that engine back on will require some time and require some lag, which will take a little bit longer. And then I also think payer mix is important to think about because not only from the fact that, you now have 20 million plus more unemployed individuals, but also the fact that, at this point, the government is probably a more secure payer for services like dental versus somebody tapping into, out of pocket and or sort of their commercial insurance. But I think the real sort of fulcrum in all of this from a recovery perspective is around the ability to open an office, which depends around sort of CDC and OSHA guidelines for COVID-19 protocols. And that in itself can be pretty challenging all the way from revenue side of the equation as well as the cost side of the equation. On the revenue side of the equation, and we don't know the guidelines that they will come out with at this point, and it's anybody's guess, but it seems logical there will be restrictions around number of patients you can have in an office at one time, or number of providers or staff you can have in an office at one time. Some of these may be offset, and I've heard a lot of my clients talk about extended hours, longer extended days in a week type scenarios, which may offset some of that revenue compression. But there's also a cost component to this, which is around sort of PPE, gowns, UV lighting, et cetera, which all could add to the operating expense of a dental office and potentially change, at least for some time, the near term, the four-wall economics of that office. The silver lining in all this is, I think, coming out of this, and we're seeing sort of movement or activity around this already. The solo practitioners, the smaller practices, they on average had anywhere from 20 to 45 days of cash on hand, relative to an average DSO, which had anywhere from 3 to 6 months, has 3 to 6 months of cash on hand, supported by their private equity partner or their lender. And this is as of sort of first week of March. They're extremely motivated thinking about partnering with the DSO, not only for the stability and the lack of burden that this this crisis has brought upon them, but also for really sort of their ability to sort of follow and be compliant with ongoing or new protocols that may be put in place. So that's a little bit of sort of what I'm seeing from an M&A perspective. I think folks ask questions around valuations. What we are seeing, there are folks there's a bucket of DSOs who are well capitalized. They've taken all the defensive strategies and stabilization priorities in place, some of which we discussed. Bart and his team discussed on the call earlier today. And then there's, sort of focusing on some of the offensive and optimization priorities, telehealth being one of them, evaluating sort of value-enhancing liability management strategies like debt repurchase, et cetera. Thinking about sort of opportunistic M&A and shoring up capital to do that. And in terms of that particular venue where they have add-ons under LOI or sort of active sort of pipelines of deals that they're looking to add on to the existing portfolio, the dynamics around valuations have changed. I don't think in the near term there will be a disconnect between seller expectations and buyer expectations, and some of that is being bridged by things that we have not spoken about in a long time, like seller financing and deferred purchase price and earnouts, which have become sort of commonplace. This is also true because at this point, new sort of financings for DSOs or leveraged buyouts or drawing of delayed draw term loans to do acquisitions is not really available because people are really trying to understand what the true EBITDA is for a practice. So some of that is also to bridge those aspects of a M&A sort of execution. So coming out of this, what do I think? I think Q3 is going to be an important quarter for the DSO market. I think you'll probably have seen enough recovery at that point to figure out exactly where folks stand. It will have to be a phased recovery, otherwise most DSOs will have gigantic restarts or de novos on their hands, which are not sustainable on a sort of a long-term basis, and they will have to be sort of phased in depending on which geographies, which service mix, which payer mix offices are performing better, and then that'll be a sort of true test of really looking at what the market is sort of bearing at that point. And I think the M&A activity will probably start somewhere around Q4 2020 to late Q4 2020 to early Q1 2021, because just think about the mental gymnastics that you have to go through to figure out what the true EBITDA is, not just the dip because of COVID-19, but also the surge because of COVID-19, all the adjustments related to the government stimulus money that has gone into the practices, the layoffs and the furloughs that have happened, but also sort of the working capital dynamics of drawing it all the way down and rebuilding it back up. So my prediction would be sort of Q4 to Q1 2021 is where you will potentially see some activity. There are a bunch of folks who are on the offense who are working towards shoring up capital so that when the market does open, they can execute on the M&A strategy and capitalize on this market opportunity where there's a bunch of dislocation and a bunch of shuffling will take place. So I'll stop there, Bart. I'm happy to address any questions.
Great. Thanks, Karan.
Go ahead, Kayla.
Yeah, I'm just seeing a number of questions, and you partially addressed this, but I think that it would be relevant. If there are particular dental subspecialties that you believe are going to rebound more quickly or might be more ripe for purchase due to being maybe perhaps more essential functions or rebounding more quickly.
Yeah, so as I mentioned at the beginning of the discussion, if somebody needs a root canal or needs a wisdom tooth extraction, they're just not going to wait because of the pain factor or the emergent needs requirement in that. So if you really think about the 20% volume that is still existing out there in dental offices, a lot of that has to do with endodontics and sort of oral surgery type activity. So I imagine that those would be the easiest or the fastest to rebound. I think the ones that'll take probably longer is somebody who, has a healthy oral health and is looking to sort of go into doing their routine cleaning and exam type activity. It probably takes a little bit longer to rebound and come back into the flow.
That absolutely makes sense.
Well, I know we also got a few questions on the Main Street loan program. I think just in terms of eligibility and who that's for, and I think some of the details are still forthcoming, but in broad strokes, dental practices, DSOs, generally are probably going to be eligible for the Main Street loan program. Is that a fair statement?
Yes, as long as they can meet the applicable leverage ratios, they likely will be eligible. We've seen a couple of questions here on the dashboard that ask whether or not they're currently open for applications. So the answer is no, they're not currently taking applications. They still are working through the comment period. But of course, everyone is working to understand the various terms and conditions and understanding what lenders may be available in this space to service those loans. So the comment period closed yesterday, I believe, so we do expect to get some more information. I believe the Fed did release its report to Congress last night, so that is now available for people on the line that have been waiting to see that. I've also seen a number of questions about who are the eligible lenders. It is not every lender that is able to make these loans, but you have to be a U.S. insured depository institution, a U.S. bank holding company, or a U.S. savings and loan holding company to issue one of the new loans. And then there's a couple of other questions we've got on this. I'll just go ahead and try to answer. We've received some questions on whether or not the loans are forgivable. They are not. They are not a forgiveness program like the PPP program. They are required to be paid back, but they, like I mentioned at the beginning of the program, they have reasonably low interest rates and also no prepayment penalties. So for the new loans, so that's an attractive element. And then one other question I have seen here on the Main Street loans that aren't entity specific is, are they the same thing as an EIDL? So no, EIDLs are a different program that are administered by the SBA. Those are disaster loans. They're also available, but they are not the same thing as these Main Street lending loans. So Bart, I think those are some of the high level points.
Yeah, and the EIDL loans, aren't those more for like frontline kind of responders who are actually treating COVID patients?
Yes, that's the place that we've seen them being used most frequently.
That was like one of the first loan programs. Those rolled out even prior to the SBA 7A loans under the PPP. I think generally haven't seen many DSOs applying for those or dental folks applying for those. Those have been mostly hospitals, primary care physicians, things of that nature. And also, at one point to make, the Main Street loans are not forgivable. They're very low interest rate, but they're not forgivable like the CARES Act, SBA PPP loans, correct?
Correct. They are not forgivable. They must be repaid.
And the terms are very favorable, but you do have to repay them. I think the interest rate is like 1%. I'm sorry, it's a little bit higher than that, but it's a very low interest rate, and it's repayable over 4 years, and it's generally a good program. But I think the view is that if you're eligible for the SBA program or the PPP program, that's the one to go with, because ultimately it could be forgivable.
That's right. And for anybody that's interested in the nitty-gritty terms, because we have seen some questions here on the dashboard about the calculations of leverage and how you actually go through the process of looking what loan terms you would be receiving. As of April 9th, the Fed and the Treasury Department released a few term sheets or primers on these various loans. They are available on the Federal Reserve's website under their press releases. And if you look on around April 9th, they should be able to be found for everybody on the phone.
And Joel, let me just pause there. Are there any questions that you wanted to answer? I know some of them are pretty specific and may not be suitable to answer in this type of environment, but I know we can follow up with them after the fact.
Yeah, just real quick, Bart, one of the questions related to billing specialists would be covered under the Act, and I thought it might just be helpful to mention, because I indicated earlier that a healthcare provider would be excluded from the Families First Act. It's an extremely broad definition. Just to give you an idea, it says that a healthcare provider is anyone employed at any doctor's office, hospital, healthcare center, clinic, post-secondary educational institution, and it goes on. And so when the language says anyone employed, I think there's a decent argument that if you fall under one of these categories, which is extremely broad, that billing specialists would be included. So I wanted to at least answer that question.
Great, thank you.
And Bart, a couple of questions that come up on the M&A side that I'm happy to address, which may be helpful for the broader audience. I think one of the folks asked, where do you think the current volume is overall for whatever visits or procedures are actually occurring. So based on sort of several conversations that I've had over the last couple of weeks, people, again, this is a evolving situation. So in many instances, people have said that their sort of average daily revenue or average number of visits has actually been going up. Again, it's also geography specific, but typically 20% off the overall volume is where things have shook out. And one way to sort of triangulate that is, annually there are roughly around 2 million plus dental related visits that end up in the ER, and a lot of those are being rerouted to dental offices in the community. Another question that somebody asked here was, hey, do you see new groups or platforms coming on given the dislocation to acquire and roll up some of these dislocated or practices that are struggling from a liquidity perspective, et cetera? I think it's going to be challenging for something like that to occur in this environment, specifically because the value proposition that a DSO brings, other than the fact that there's all this back office infrastructure and support and ability to market, recruit, training, onboarding systems, infrastructure that they bring. A lot of value is created between what sort of individual practice is worth relative to what a platform is worth. And for the most part, a lot of that has been supported by relatively inexpensive capital in the form of debt. To be able to be doing that with all equity, because the lending environment is tightened up somewhat. To be doing that with all equity is going to be challenging. So I don't see and the other thing is really around sort of availability of managers and executive talent in this industry to be able to do that. So I do really see this as an opportunity for existing well-capitalized, stable entities, albeit not 100% operational at this moment, but they will see more opportunities. And the sellers will also rely on the fact that, hey, I want to partner with an entity which has a backbone and infrastructure and a reputation and has the ability to support me, and they will follow through like, hey, what did this DSO do during this crisis? Like, how did they sustain themselves? What defensive and offensive strategies did they employ, and where are they positioned going forward?
And Karan, you mentioned earlier just time to come back to market and kind of what the M&A market looks like. You had said third quarter. I don't want to put words in your mouth, but one of the questions we had was what about the dental industry more broadly? You may have already spoken to that, but maybe if you could just reiterate.
Yeah, I mean, I just don't, like as I said, I think Q3 is going to be a deciding quarter for a lot of DSOs, and it's unfortunate that in a healthcare crisis, the folks that are impacted the most are healthcare providers. It's almost paradoxical in that sense. So Q3 is going to be important because it's going to give you a sense for how quickly the recovery is happening. I saw a survey as of April 14th, so April 13th, where 60% of the respondents, at least from a routine visit, said they're going to delay or postpone. Didn't really talk about what the extent of the delay or postponement is, but the good news was only 13 to 15% said, hey, they will actually cancel sort of their healthcare visits, and it's even less so on the sort of elective, some of the elective procedures. So I do think Q3 will be an important factor, which will give guidance as how quickly some of these things are bouncing back, and how far back the ball is actually going up in the air relative to where they were before. And Q4, Q1 is where people will start engaging and thinking about, okay, so I've got the dust settled here. I understand my numbers. I understand what this dip and the surge was. My working capital is back on. My liquidity is on point. My staffing is on point as well. And I can think about some of the M&A things that I was thinking either from a liquidity or exit perspective, or even sort of doing some transformational transactions.
Great, thanks, Karan. And we've also received a couple of additional questions just for the benefit of the group, going back to the interplay between the PPP and the Main Street lending loans. There have been a number of questions on whether or not you have to choose one of the two. You are not automatically precluded at this point, based on the guidance that we've received from the Department of Treasury, from receiving both. It's just that you'll obviously need to be cognizant of your current lending relationship before you were to take on both loans, and you'd have to closely examine the borrowers on your current debt. Bart, are there any other aspects of the PPP program that you wanted to address before our call wraps up here? I know that we've received a couple of questions, but many of them are quite fact-specific and may need to be addressed.
Yeah, I appreciate that, and I know we're kind of out of time. Let us plan to do this. We can follow up on the more specific questions after the fact. Happy to do that, but we'll absolutely make sure we get answers out to these folks. I think we probably need to cut it off there just in the interest of time. So we appreciate everybody joining, and Joel, Karan, always an education, and thank you for spending some time with us today.
Yeah, no, thanks, Bart. I appreciate you setting this up and having me on, and some of the questions that left unanswered that fall in my bucket, I'm happy to reach out to folks individually and to address those.
Great. Thank you very much. Thank everybody for joining.